Hello again, everybody. So today the question we're going to answer, this was sent in by a viewer. The question is, can knee pain cause plantar fasciitis? So first of all, the short answer is yes, it can be a contributor. The only question is how big a contributor, whether it's the only reason why you're having plantar fasciitis. Almost certainly the answer is no there, but knee pain can be a contributor to plantar fasciitis. First of all, let's describe what plantar fasciitis is. So if this is your knee, your leg, and your foot has an arch on the bottom of it, and it should, unless you're flat-footed, which means your arch has fallen. Now you can think of your plantar fascia as a strip of leather that runs from your heel to the base of your toes. And its job is to help keep that arch up. Should be stretched taut. If the bones in your foot get lax or they can't support themselves, then that can stretch out that plantar fasciitis and let your foot fall and you become flat-footed or have pes planus, which is the term for that. Now, that plantar fascia that stretches across that base, the term plantar fasciitis means inflammation of that fascia or that strip of thin leather, if you want to think of it that way. And it usually presents as having heel pain right up underneath the base of your heel. It's often worse first few steps out of morning when you're first few steps out of bed in the morning when you're walking across the floor. It can be excruciating. It feel like a knife sticking in there. It can make you feel like you don't want to step on your heel when you want to walk on your tiptoes. It's a super common problem. It's an overuse injury, and all that means is that you've given that heel area or that flat fascia more work than it's able to adapt to. So it's commonly caused by starting a new running or jumping routine. This could be jumping jacks, running, starting playing flag football, or any high impact activity where both feet are off the ground at some point. And it doesn't mean those activities are dangerous. It just means that your ramp up angle into that thing was too steep. Like you went from doing none of it to doing a whole bunch of it. Like maybe hours at a time, several days a week, instead of kind of maybe easing into it at a more shallow ramp up angle. So that's the kind of quick and dirty explanation of plantar fasciitis. It's famous for being a nagging injury that can linger, but when you give plantar fasciitis the environment it needs to recover, it does pretty reliably, and you can get back into your program at a more sensible ramp-up angle. However, the relationship between plantar fasciitis and knees is that if you were ramping up too quickly into a run-jump activity, then not only is your foot and heel taking that beating, it's your knee is as well, and the rest of you, hips and low back and so on. So the same activity that gave you the plantar fasciitis could have also irritated your knees and given you some tendonitis there, let's say, or have just been too much activity given to your knee in too big of a dose. So here's the other possible connection. So if it hurts to walk normally, then that's going to force you to be gimpy when you walk, or maybe you're trying to walk more on your tiptoes or the outside of your foot. Knees don't like that. So forcing if your feet are forcing you to walk abnormally, that just means it's more likely to hurt things up the chain because they can't move normally as well. Knee is a hinge joint. It only likes to move in one plane. So if it's being forced to bend as it moves, inside or out, or if it's forced to twist, or if it can't bear its load if it's being forced to do the workload of your foot because your foot doesn't like it, that can irritate knees and give you knee pain there. Now another possible connection too is a huge risk factor for plantar fasciitis down in your heel is tight calf muscles. So your calf has it's a long meaty rope that starts up behind your knee, attaches to the knee. So it is a knee supporter, runs down, and the connective tissue kind of spreads out and runs across the bottom of your foot. There's a very strong, very direct connection between tight calves and plantar fasciitis. If that gets stretched too taut and it's not elastic enough, it makes you more likely to have plantar fasciitis and also knee issues as well, because that means that calf muscle attaching behind your knee is too taut, doesn't let your knee bend as freely as it should. So loosening tight calf muscles with calf stretches and a massage, whether it's you giving yourself a massage, you getting a massage, or you foam rolling your calves, those are the main tools that loosen tight calves and can help with both plantar fasciitis and knee pain. So I know that's it can be a little confusing, But the answer is yes, plantar fasciitis can irritate knee pain or be a contributor to knee pain if it's forcing you to walk abnormally. And also, the same activities that gave you the plantar fasciitis can give you knee issues as well. The solution then is backing off relatively from those things, giving your knee and your heel enough time to recover, and then gradually ramping back into them at a rate that is more sensible and lets your knee and foot adapt to those things. As always, if you feel there's something seriously wrong with your knee or foot, always go to the doctor and find out. Get them to check you out. It's worth knowing what's wrong in the first place and not risking making something worse in the future. So I hope this has been helpful, and I hope that makes some sense. As always, leave us some comments below. If there's a question you would like answered, let us know in the comments below. Subscribe for more stuff, and it's been great seeing you guys.